Okay, here's my presentation on the circulation of the heart. Blood will come from the top of your body into the superior vena cava and up from the bottom of your body into the inferior vena cava, and it is deoxygenated and is low in oxygen and high in carbon dioxide, which is waste. And it will come into the right atrium, and then it will go through the tricuspid valve, which has 3 flaps, and these flaps make it so the blood flows only in one direction. They open and close and allow the blood to flow only one way into then the right ventricle. And then from the right ventricle, they go through the pulmonary valve into the pulmonary artery, which is deoxygenated blood in an artery. And that branches off into your right pulmonary artery and your left pulmonary artery, which goes into each lung on the right and left side of your body, where the blood then gets rid of carbon dioxide and gets rich in oxygen and returns through your left pulmonary veins and your right pulmonary veins, which there's 2 on each side. So then in your left atrium, you have oxygen-rich blood. You have 4 vessels dumping into there. Oxygen-rich blood, which then go through the mitral valve or bicuspid valve, which has 2 flaps, and then that goes into the left ventricle. And the left side of the heart, the left ventricle has a thicker wall than the right ventricle because it has to push the blood further into the body. And there is a space in between the right and left ventricle called the interventricular septum, which divides the right and left ventricle. Then the valve that from the left ventricle up into the aorta is the aortic valve. And then the aorta is the largest blood vessel. It's about the size of a garden hose, and that goes up and arches over, and it has 3 branches to